Breast cancer is the most common cancer in women in the United States, and October kicks off Breast Cancer Awareness Month. 9 News health expert Dr. Payal Kohli joins us live to talk about what you need to know to prevent breast cancer. Dr. Kohli, good morning.
Hi, good morning.
So what are the signs and symptoms of breast cancer?
So breast cancer, Natasha, usually presents with a lump in the breast. And the point of that is you actually have to go looking for the signs and symptoms because you may not necessarily have them, especially if the lump is small. Now you can see skin changes occur on top, you can see nipple discharge. Some women have breast pain because of the lump or discomfort. You could also get a lump in the armpit or the axilla, which is where the breast cancer would spread to.
Right, so you really have to pay attention to your body.
Exactly.
Yeah. Can men get breast cancer?
You know, this is not appreciated, but yes, men can get breast cancer. In fact, out of every 100 breast cancers, 1 out of 100 of them occurs in men. Usually gets diagnosed a little bit later, has a little worse prognosis because men aren't used to thinking about getting breast cancer.
What are some of the risk factors for breast cancer?
So risk factors for breast cancer are ones that we can change and ones that we can't change. So the ones we can't change that we're stuck with are age, our genetics, so if you have a family history of breast cancer, how dense your breasts are. Every woman's breast is different, and the density of the breast predicts whether or not you'll be able to detect and pick up a cancer. Also, what age you started your period and when you got into menopause, really how much hormonal exposure you've had, whether you breastfeed or not, whether you've been pregnant or not. The ones that we can't modify, those are the ones we can't modify. The ones we can modify, get off the couch, physical inactivity, alcohol usage, birth control usage, and then like I talked about breastfeeding and pregnancy, those are some choices we can make.
Right before this segment, you know, we kind of talked about how breast cancer is #1 for women here in the United States and kind of why. Does diet have a correlation to incidence of breast cancer?
You know, the studies here are mixed. So some studies are showing, yes, that diets rich in fruits and vegetables and calcium-rich products can be associated with a lower risk of breast cancer. There's also data coming out of Asia, especially in Asian women, a high consumption of soy can also be associated with lower risk of breast cancer. But we know one thing is that people who are obese or heavy, that fat actually makes estrogen. And that's thought to be one of the mechanisms by which it increases the breast cancer risk. So eating a healthy diet, you can never go wrong with that. I would strongly recommend it.
Right, no, that makes sense. And it just feels like younger and younger people are getting diagnosed with breast cancer. So what are the recommendations for mammograms and you know, when should you be seeing your doctor?
So I think the average risk woman should, at 40 years, talk to her doctor about whether she should start mammogram screening. Most of 40-year-old women should probably start it. It's also really important to do self-breast exams because you yourself know your breast better than anyone else, and you can tell if there's a change. And then once a year, you probably have to have a clinical breast exam, meaning a healthcare provider, your doctor, your nurse practitioner, whoever should also check your breasts. If you're higher risk because you've had a family history, if any of those risk factors we talked about, think about it even before 40.
Yeah, so important to listen to your body and just advocate for your health.
So important.
All right, Dr. Kohli, thank you.